Joining us tonight for a special webinar. Those of you who have attended our other webinars, this is going to be a little different. We don't have a specific topic here other than, I guess, Dr. Kravitz is the topic. Any questions you have about orthodontics or JCO or anything those related to those areas are welcome. How we're going to handle this, and I'll repeat this a few times as people come on just so they know what the deal is. On your little GoToWebinar strip there, you'll see a questions tab, and whatever questions you want to ask Dr. Kravitz, just type them in there, and I will be reading those out, functioning basically as the moderator as we go. So you can go ahead and type those in there at any time, and we'll get to as many questions as we can. Before we start, I just want to say, so the reason we're doing this, of course, as I think all of you probably know, is that Dr. Kravitz was recently named the 4th editor-in-chief in the history of JCO. And I've included a link to the announcement we put on the our Facebook page in the chat if you want to get more background information. But just very generally, JCO's been around since 1967. Our first editor was our founding editor, Dr. Eugene Gottlieb. And then second editor was Dr. Larry White. At that point, Dr. Gottlieb became the senior editor. And Dr. Bob Keim took over 20 years ago now from Dr. White. And he is now becoming the senior editor. So he will still be involved as Dr. Gottlieb was when he was the senior editor, but Dr. Kravitz is now the man in the chair, so to speak. The other thing I want to mention about JCO is I've also included a link in the chat to our website, 2 links actually. One is to our subscribe page and the other is to our webinars page. Those of you who haven't been to any of our other webinars, we have a lot of them. We try to do 5 or 6 a year. They are free for subscribers. So if you have a subscription to JCO, you can attend any webinar for free. You can watch the recording of any webinar for free. You can see all the ones we've done on our website. If you are not a subscriber, they're $100 to attend live and $80 to watch the recording. So you can see how that would add up very quickly. So it's a pretty good benefit of subscription beyond, of course, just getting the journal itself. You also get access to our whole archive, goes back to 1967. And our other web features like our digital shorts section. So before we start with the questions, I just wanted to make sure, Dr. Kravitz, did you want to say anything off the top before we start asking these questions?
Hi, everybody. Again, huge honor. Thank you so much for joining me tonight. And thank you so much for supporting the JCO. I think all of you know from my many Facebook posts and videos how much the JCO means to me personally. It's meant so much to me even as far back as residency. And I thank you for your support. I hope you continue to subscribe, and I ask you to continue to encourage others to subscribe. Our journals need us, and I think you're going to really like the future for the JCO.
All right, thanks. So again, just for people who are just arrived, if you have a question, Dr. Kravitz, you can just type it into the questions tab over there on the right, or on the right on your screen probably, unless you moved it around. It's in your GoToWebinar strip, and we'll try to get to as many questions as we can. And we're not going to do unmuting people, and it's too much of a hassle to go through all that. So we're going to just do type questions, and I will read them out. So just type them in to the questions tab, and we'll be reading them out there. So I'll kick things off while people are still getting settled. What is sort of your vision, Dr. Kravitz, for the future of JCO in terms of what kind of topics we're covering, how we're covering them, that sort of thing?
Sure. I think immediately you're going to see a lot of topics on mini screw supported expansion. You're going to complex clear aligners, not just Invisalign, but also in-office aligners, and not just before and after cases, really breaking down biomechanics, breaking down attachment type, breaking down sequencing, making sure we're really explaining the magic of some of these beautiful cases that some of these clinicians or lecturers present online. It's going to be very important. You're going to see traditional everyday mechanics. I think sometimes we don't need to just post very unique or difficult or mini screw cases. We can post standard orthodontics with standard techniques. It doesn't have to just be non-extraction or extraction, just good everyday ABO orthodontics, where you can look at this case and learn a different doctor's mechanics. I think there's great value to that, and I encourage that. You're going to see a heavy emphasis on wonderful photography, crisp illustrations. I want this journal to continue to be beautiful, where you look at each article, each illustration, and it really teaches so much with each image. So what I hope is that this journal continues to be very relevant, and each article is action-packed. That's the way it's always been, right? This is a journal where you can pick it up and immediately apply it into your clinic. So if there is a topic that is important to us, we are going to include it right away. You're going to see in-braces cases. You're going to see customized brackets with light force and Clowen. So if there's new technology, artificial intelligence, we're going to incorporate it right away. So I don't want it just to be stuff that's on the fringe. I still want, like I said, everyday quality mechanics. This is really the clinician's journal. And sometimes if you go too far into the future, this stuff is hard to apply. But I want you to be able to pick up an article and read it and say, you know what, I can change what I'm doing in my office this afternoon. And that's going to continue to happen.
Great. So question, an orthodontic question. What's your take on using fixed functional appliances on class 2 adult patients with retinognathic mandible who refuse surgical treatment?
Yes. Hey, Neelash, how you doing? So what's my take on using a functional appliance on an adult? I understand the question being that if a functional appliance is not getting any skeletal change, why not just simply use a functional appliance on an adult? And I have certainly used a Forceps on an adult begrudgingly, and those are very, patient unfriendly type of appliances. Here's how I would answer it. You certainly could, but I do not. Certainly we're not getting any skeletal, and we may not be getting any skeletal even on a growing patient. These are primarily distalizing appliances that will distalize the molar and advance the lower incisor. If I have an adult patient with a severe retrognathic mandible and they're not doing surgery, I'm looking at upper bicuspid extraction. And my rule for adult extractions is I like to do maxillary second premolar extractions. Now, I understand that the second premolar space relapses very quickly, right? It's hard to keep the first premolar and molar contact together. That space will reopen before they leave the office. But I don't think adults want as much retraction as they say they do. So even adults that present with dental protrusion, retrognathia aside, where I'm taking out bicuspids, I'll always favor the second bicuspid in an adult. The worst thing you can do is over-retract an adult patient. Now, when I'm doing that, I will accentuate my mesial root tip on my molars to try to keep that extraction space closed as best as possible. So, Nilesh, to answer your question, I understand why you could get away with it, right? If these appliances are primarily dental appliances, I'm not going to do them. Adults will be very, it is something that I would be very surprised if they could handle. Braces alone sometimes takes adults past that threshold where they are able to manage their stress. A functional appliance would send them well beyond that threshold. I will favor either leaving them with overjet or extracting the upper bicuspids. I think you'd be better off doing like a mini screw supported distalizer. Benedict Wilhelm has published many articles on those types of appliances than trying to use a functional appliance. We're not treating that retrognathic jaw in an adult. Hey, Dovey, how you doing, buddy?
Yeah, and by the way, if you have a follow-up, you can go ahead and type that in. We'll try to grab those quickly. If as your question is getting answered, you had a follow-up based on something Dr. Kravitz has said, just go ahead and type that in there.
And so I can read them too. It's okay if I just read, if I go down and just kind of read?
No, it's fine. I don't mind. I just wanted to address one question that just popped up. Dr. Pereiro actually was asking where we could find your lecture on Herbst versus Mara, and that, I'm not sure specifically which one he's thinking of, but you did a webinar on that.
Webinar, yes. Yeah, so that webinar is available on the webinar list. So if you go, so that's one of the great benefits of subscribing. So I never mean to be, to push this too hard. It's not my nature to do that, but we do hope you subscribe. And one of the great benefits, along with the incredible material in the journals, are the webinars. Mike Maru, I hope, Mike, you're listening today. Mike gave the most incredible gingival lecture presentation last week. I stopped where I was. I was getting ready for my angle lecture, and I sat down and just was glued to the computer for an hour. I have heard the best of the best lecture on gingival laser surgery. Laser gingival surgery. None of them compare to how well and how crisp this lecture was. I sent a letter to the email to the AAO committee saying this is what needs to be presented, and I encourage you. So if you're doing laser surgery, listen to Mike's. But Dovey, on that webinar section, you'll see my Mara Herbst presentation. Right. Thank you so much.
The link to that is in the chat, but also if you go to our website, jco-online.com, click on continuing education, and then click on webinars, you are going to have to, it's the particular webinar Dr. Kravitz is we're talking about, it's a little older, so you're going to have to look at view all. The whole list is there. If you're a subscriber, make sure you're logged into your account, and you will not have to pay a fee for any of that. Dr. Pereiro actually had another question, which was, will practice management be highlighted as, I should say probably continue to be highlighted, because I feel like that's something that we have always done here at JCO. It's been one of our calling cards. So will it continue to be highlighted in the future in JCO?
Yeah, so absolutely. We brought on Anne-Marie Gorzica. Anne-Marie is a great friend and just an established author. If you haven't read her many books, I encourage you to do so. But she has a real grasp of the business world, and she is like Dr. Levin for orthodontics. She is just wonderful. So from hiring and firing to we just had this great article on embezzlement that was just in the recent JCO. So there is going to be a heavy emphasis on practice management. Because I think that's what orthodontists want to know. And that is part of clinical orthodontics. And Anne-Marie is going to be vital to that. So look out for her frequent articles. And if you have subject matters, let me know, and I'll pass it on to Anne-Marie, and she will write about it. So from team meetings to HR to marketing, we're going to include all of that stuff. Great point.
This is also a good place to say that we part of her what we're doing with Anne-Marie is that we have this section called Ask Anne-Marie. So if you have a question, you can email us, and we will potentially include that in a future issue with her answer. So that is very much designed for her to take people's questions and answer them in JCO. So if you have a practice management question, just feel free to send it to us. Put Ask Anne-Marie in the subject line, and we will get to it. So another question: how do you help motivate patients and help them maintain their oral hygiene during treatments, especially when you are not the practice owner in the office? And debonding early for poor oral hygiene is not practical for the majority of your patients. Do you do anything special?
Yeah, so hey Jacob, how you doing, buddy? Now that is a question I get. I'm very grateful some of the comments that people post when I share my cases on the hygiene. So, we certainly have patients with bad hygiene, but what we do at our office, and you've seen me do this, is we don't let the patient go to the sink and brush. They certainly do, and we have toothbrushes up there, but what we are doing when they're in the chairs, we are brushing their teeth. I will, just like I open up my instrument kit, I grab a toothbrush, I pop it open, and I am brushing their teeth. I want them to feel what it takes to get the food out. And a lot of times you'll have your patients brush their teeth and they come back and sit down and there's still food all over their mouth. So I actually want them to feel how I want them to brush. I want their gums to bleed a little bit if their hygiene is poor, so they see it. I want them to feel the way I brush above their brackets and below their brackets to help get the food out. And I think this is all very important to them. And I'll say, hey, listen, this is where I want you to be brushing and how I want you to be brushing. So we certainly do have patients with poor hygiene, but we're on top of it, and we talk. And you really, the way things are now, you really can't say to a patient, your hygiene's unacceptable. Sometimes I go in like a lion, out like a lamb. Go in hard but come out. But the way things are, you have to be very. You have to make sure the parent is okay with you having that conversation firmly. So sometimes I'll say to the parent, is it okay if I be a little strong with regards to hygiene? Sometimes I'll say, go at it. And I still say, we're looking for A's. I know you're an A student, but this is B+ work. I need you to give me an A. And sometimes I'll be a little bit stronger than that, but most of the time, it's still positive. And we are reinforcing it. So answer your question, number one, we brush their teeth. Number two, I know this is what you said couldn't be done in your practice, but we do take the braces off. So my rule, and I always say this, I always call these things Nealisms. I've made so many mistakes, and the one mistake you are not allowed to make in orthodontics is you cannot cause damage. You're not allowed to. This is an elective procedure. You cannot cause damage, and damage doesn't just have to be root resorption or bone loss, or a poor occlusion. Damage could be scratching the enamel when you polish the teeth, right? Dentists get very upset with scratches, so you have to make sure you're using proper burrs. I have a whole different, we can go over, I've always wanted to write an article on burrs. I know it sounds silly, but I don't think people quite understand burrs. You can't scratch teeth with burrs. You can't cause occlusal wear because you used abrasive turbo material. And on this note, you cannot keep the braces on if the hygiene's poor. So I take the braces off. I do. If the hygiene's really poor, the braces come off. And if I have to, I'll go to an 18 night tie or an 18 steel with power chain, get those braces off, and immediately start the remineralization process. I also think if I see any signs of like depression, I always say, this is for the associates out there. I say a young doctor looks at the teeth, but an older doctor looks at the patient's eyes. When you start to see that look in the patient's eyes, where they're going through a lot, sometimes taking off the braces will really help, and you'll see the hygiene improve right away as well too. So, but I don't know if it's acceptable to keep the braces on the teeth. I think you can argue that a less ideal occlusion without 10 cavities is better than an ideal occlusion with rampant caries. So I do not keep braces on if the hygiene's poor. And with that, if I have to switch them to in-house aligners or Invisalign, I will do that for free. And I understand the argument. The argument is, well, if they're poor at brushing, why would they be compliant with their Invisalign? I know, I get it. But now they're in charge of their teeth. But if there's braces on the teeth, I'm in charge of their teeth. And what's going to happen with patients with poor hygiene is a parent is not going to get mad at a child and say, you have cavities because you didn't brush. They're going to go to a dentist. A dentist is going to count every hypomineralized spot as a cavity. And then you're going to get a phone call from an upset parent that there's 17 cavities. There's not 17 cavities, but the dentist is going to do 17 fillings. And there you are. So my approach is I always like to take ownership, and I always like to take responsibility, and I always kind of look to myself. And the way to do that is if I have poor hygiene and really inflamed tissues, you start to see like A-nug and all these things going on in the mouth. Braces are off. I will switch you to Invisalign. If I lose money, I lose money. I'm not worried about money. Some cases are like this. And this patient just could not tolerate treatment. It was just, this was not for them. But you can't keep them hostage in braces. So what I do is I brush. If it's not working, I remove the braces, and I even switch them into clear aligners, or as you saw, I put in a functional appliance at the end of treatment. But the brackets are off the teeth. I hope I answered that question, Jacob.
Do you do anything different with adults if it's an adult with poor hygiene? Because
yeah, no, it's a great question. The adults, the problem. So here's what I find with the adults: the hygiene is not so much the issue. It really is what I call a threshold of stress, where getting braces is stressful as an adult. You feel young, you feel less attractive. It interferes with your life. So I always tell adults, my job, aside from giving you the smile that you want, because if you're going to get braces, I really have no excuse but to get a perfect result, is I want this to minimally interfere with your life. Okay, I really don't want you thinking about your teeth as much as possible. But I will tell you, there are patients who, the day after they get braces, they want them off. It creates an anxiety that is beyond what they can manage, and I'm sensitive to it, right? And I always try. So I always want to make sure that my adult patients really do want braces, and I will talk to them. I'll say, you got to make sure you want this, because it isn't an easy road. So I don't find hygiene to be an issue with adults at all, but I do find that irritations are harder. They're more sensitive in the mouth. They're more anxious about anything going any amount off course. Any infinitesimal small change that is from the deviation, you're going to get an email. And I think that's the harder part of dealing with adult patients.
Sure. All right, different topic. First of all, congratulations from this questioner on your new position, and thank you for sharing your knowledge. What software do you use for in-house aligners? Why don't we just start with that one, since that's the other questions are on a slightly different topic. So what software do you use for your in-house aligners?
Thanks, Nishal. How you doing? So we use ULab. So we are really happy with ULab. I have to admit, we have such a huge Invisalign volume. It's quite remarkable. When I've shared some of my numbers, I try to not talk about that kind of stuff, but it's really quite remarkable. I can't imagine too many people with bigger Invisalign practice, but we need to learn in-house aligners. You have to learn this technology, and so we do it. We don't use in-house aligners to replace Invisalign. That's not my intention. I do them for minor tooth movements on relapses. I will do it on cases where, maybe I have to take off the braces early, or maybe I finish the case, they're in a Hawley, but in the Hawley, the extraction space opened. All those reasons. So they're retainers and modified retainers is how I would say it, right? So I don't want to be making modified Essex in my office. That's how I'm using it. I do have a colleague, Bobby Kumra. Bobby, I hope you're listening, who does this very well as replacement for Invisalign. That's fantastic. And I think someday we'll be there because we're going to have to be there. But I love Invisalign. I love the ease and simplicity of it. But we are very happy with ULab. But I still think they are quite separate from Invisalign.
And I should point out that just another webinar, Dr. Geary, this is now almost 2 years old, but he did a webinar on managing the clear aligner practice back in 2019. So some of the technology may have slightly changed, but I think the thrust of how to do that, I think, would be helpful for anyone wanting more information on that. So this is sort of a two-part question here. So what are your thoughts on transitioning a practice to indirect bonding or to custom brackets?
Well, I love it. So I did a lot of indirect bonding with Rocky Mountain, maybe 8 years ago. And the reason I pulled away from it was indirect bonding works great if you are treating patients who are 13, 14, 15 and getting their braces, or adults. But if you're treating 11-year-olds or people in the late mixed dentition, I just found indirect bonding not to be advantageous. It was just much easier and quicker for my staff to put on the braces and for me to check them. And we could do that really in 15 minutes pretty quickly. But indirect bonding is fantastic, and it's a skill you need to learn because the customized brackets and the lingual brackets are going to require that you learn them. So I have no problem with indirect bonding. It's something that should be taught in every residency. If you're a faculty member out there, you should mandate that residents do 2 or 3 indirect bonding cases because they're going to need to do it, because I believe customized brackets are the future of orthodontics. You saw a move forward with Sure Smile and Insignia and then Incognito, and you're seeing Light Force and Cloen and Inbrace and all this wonderful technology that is out there where we're not having stock prescriptions. We're putting the teeth in the ideal position, as Heather Hopkins, the great lecturer, always says, put the teeth in the ideal position and customize the prescription for that tooth. It's one of my favorite techniques that she teaches. I'm a huge fan of hers. So I think that's the future. I can't see how it's not. I think orthodontists as manufacturers, and you'll start to see more articles from Tom Shannon, who's written a great article for the JCO Christian Growth. I'm the biggest Christian Growth fan in the world. He's just fantastic. But these two doctors are really doing amazing things with manufacturing, and you're going to see orthodontists do more and more of that. How great would it be instead of purchasing brackets where we're printing them in our in-office printer? That's already here.
Yeah, and is that some degree a sort of natural reaction to aligners too,
Yeah.
where if you're doing brackets, aligners, you have this customized prescription for aligners, and in the future, if you do brackets, you have the same thing.
This is escalation war. All this is people forcing our hand and causing us to modify our approach, and this is the way things are going. That's why one of the earlier comments that Phil was talking about was, what are the new additions? You're going to see an entire new component with the JCO on a 3D orthodontic digital print laboratory articles from Bjorn Ludwig. We're really going to get heavily involved in the 3D manufacturing, of appliances. And yeah, this is going to be a major part of our practice moving forward. Whether it's expanders or brackets or turbos or auxiliaries, I think we're going to be making something and ordering less.
Right. So the last part of that question was, what is your advice for new graduates about timelines for setting up their own practice in the current market?
Well, so I always like to talk about myself and all my mistakes. I have so many. I opened up right out of residency, and I needed to. I've shared that experience before with many people, and I think it was important for me to do so. And I also don't know if I was mature enough to work for somebody. I think it requires a type of humility and reservation, and I needed to grow up a little bit. In my mind, I thought I was going to be a general on day one, and I needed to learn how to be a good soldier. And so my great mistake, my great regret, is not learning from somebody. I opened up my own practice right away, and I also started at a corporation right away while I was building my own practice. So from day one, I was on my own. And I had too much to learn. And I learned business before I learned orthodontics. And I was seeing 150 patients on day one. And I was way over my head. And, people always talk to me, how do I grow my practice faster? And I say, you're doing it the right way. You're growing it organically. And what happened in my life was maybe excelled on the business aspect of it, and too much so where it put too much pressure on me to be good as an orthodontist, and I was not. I had to get better. I had to improve. I was better at growing my practice than perhaps treating my patients. I've never really verbalized it like that before, but there's probably a lot of truth there. So I think it's okay if you grow slowly, and I think you should not be enamored by orthodontists who have swag, even though I'm wearing my JCO swag today for you guys. But you should not don't get into that stuff. Orthodontists who own scan centers and drive fancy cars, and they take their 30 staff members to meetings, and they all get the pixie cuts. And that's not being an orthodontist. Do your work, do a good job. You're treating someone's child, and if you don't have children, that's a huge deal when a parent says, "I'm trusting you with my child, do good work," because you're very young. I was 27 years old, opening my own practice and treating people, and I had a lot to learn what it meant when someone gave me their child to take care of, and I have a newfound respect having children. So to answer your question, open up. Don't worry about the market. This market of OSOs and DSOs, be your own boss, open up, don't be afraid. But if you can work for somebody, okay, if you can work for somebody, even if there's less pay working for a senior doctor than it would be going right into a corporation, please do that, because every day I get to teach my associates, and they're amazing, by the way, and they've made me Dr. Killick, Dr. Ty, Dr. Shevin, and in the past, Dr. Joe and Dr. Dan, wonderful associates that have made me a better clinician. But every day I'm talking to them about my mistakes. I'll say, don't do this, because let me talk to you about these cases that I did this on and I didn't do well. So I strongly encourage you to work for a senior doctor. If a corporation is going to pay you X amount of dollars and you're making $500 a day less working for a senior doctor, work for the senior doctor, because you're going to be so much better off. It is my great regret. And I say that, but I also don't know if I was mature enough to work for anybody. And I don't know if my life would have been any different any other way. I felt like I was going to probably have to make these mistakes on my own anyways. But I do wish I did that. And so don't be afraid. No, orthodontics, don't be afraid. But I encourage everybody somehow, some way, even if it's just a day a week, work for a senior doctor. And I wish I didn't hit the ground running quite so fast.
Yeah, I mean, I think we frequently say that this is a field of sort of lifetime learning, right? That if you're going to be an orthodontist, that means that you're going to have to commit to a lifetime of learning. That it never stops, and that just because you've just graduated doesn't mean that you have all the answers right off the bat. You have to sort of learn to walk, and then learn to jog, and then learn to run, and then now you can sprint. But if you try to sprint right away, you might fall on your face a little bit.
And I know this is a side topic, but if we're kind of talking, the problem is when speed is added to that equation, because when speed becomes the priority, when collection and EBITDA and money become those goals, you don't get time to learn. You're not focused on finishing and second molars and occlusion. You're focused on daily collection and practice growth and all the things that regional manager is pushing on you when they come into your office. And you judge yourself by how much money you made or you made that corporation, not by how well you are doing and treating that patient. And the hardest thing you will find in life is to slow down. It's hard, especially when you want to move fast. I like to go fast, but I will tell you, the world will force you to slow down because of mistakes if you don't slow down beforehand. So I agree with you, and I wish I gave myself time to learn, and I don't think I did.
And I think also the mentality of embracing mistakes. Not like that you want to make them, of course, but embracing that something was a mistake.
Yeah, I'm causing that, right? That's the hardest part about orthodontics is going. And I actually think in dentistry, we don't do that, right? We try dentistry as a whole, right? We fake it till we make it. This very Western approach of we have such bravado and we do this to protect ourselves because we've never done this, and we have to instill confidence in our staff and in the patient. But that type of behavior causes us to learn much slower, because if we're always putting on armor, we never get that clear vision, right? We never go, oh, you know what, this thing that's happening, it's not genetics, it's not their hygiene, it's not their compliance, it's not the scheduling, it's me, right? I'm doing this, and if I knew how to do this better, you know, I wouldn't have this problem, I wouldn't have this damage, right? And that's the hardest part of our profession, and that's where the regret comes, and unfortunately, that's where you learn so much.
Yeah, it's a much older editorial. Actually, I don't have it offhand. I'll try to find it here while we're answering another question. But it's a Dr. Gottlieb Editor's Corner from a long time ago about the value of continuing to basically self-score yourself, like you would if you're going for the ABO, like self-scoring your own cases to learn from them. So, so staying on the topic of corporate orthodontics, so you recommended working for a senior doctor or joining the corporation. So how do you feel about many practices joining these OSOs and essentially eliminating the senior doctor mentor?
Well, listen, I would never have any negative thoughts to anybody selling their practice or joining. At the end of the day, if people are doing good work, how people handle their business is fine. I'm happy for people who have sold their practice, and if they have given themselves an easier life or more family time, I think that's wonderful. Here's what I will say just about corporate dentistry, corporate medicine, corporate anything, because I have some good experience. It will ultimately turn into a collection goal. When you're in private practice, if we're not making money, I hate to talk about this stuff, but let's just talk about it for a second. I'm not making the money. I can handle it. I can work. It's me, right? I get paid last. But if I have sold my practice, there is millions of dollars that they have to recuperate in a few years, let's say 5 years. Plus, they have to pay that doctor a salary. And payroll becomes king. And if payroll becomes king, collection becomes king. And there are days where you're going to have regional managers and people getting involved and talking to you. And they're not going to be talking to you about case finishing. They're going to be talking to you about money. And it's all about money. And that's where overtreatment comes in. And that's why people push myofunctional appliances and Invisalign, because these are very innocuous treatment modalities. And there's nothing wrong with that. It's different. And it is going to really require a strong ethical core for us to push back on that. So I am not worried about an older doctor or an experienced doctor selling their office, because I believe they are grounded and they have their technique, and they have. I am worried about doctors who are very young selling, because I fear that they're going to create Invisalign only practices, and they're going to do phase 1 expansion, and they're going to talk about airway and things that we know just maybe are not accurate and maybe not be the best way to treat. We may overtreat, and I worry about that. And it doesn't mean that's the way it is, but I worry about it because that has been my experience. And I hope that is not the case. But unfortunately, when the owner is not involved, the decisions are made higher up. And the goal of a corporate practice is to make money. And I'm not sure that is the goal of a private practice.
I did find that article there quickly, so I posted the link in the chat, the Dr. Gottlieb article about scoring.
Hey, Adam, how you doing, buddy?
But it is subscriber only, so if you're not a subscriber, you won't necessarily be able to read it. But if you are, you will be able to read it. So next question, what are specific mechanics you take in consideration for space closure on 5s extraction cases to avoid unwanted mesial crown tip and rotations on 6s?
Yeah, so the old Wick-Alexander rule, I will accentuate mesial root tip. So if I'm banding, I'm going to seat the band on the mesial side last, really throw down that. And if I'm bonding a tube, I'm going to really accentuate the position 30 degrees, 40 degrees with the tube going gingival on the mesial side, really accentuating mesial root tip. I believe Wick-Alexander, Moody can correct me if I'm wrong here, but I believe in the 20 Principles book, the great orthodontic book, maybe the greatest of all time, I think his bands were made to add mesial root tip in, kind of like a tip back bend already kind of built into the slot. So I accentuate the band or bracket positioning because if you crown tip those molars, as we all do, that space opens right back up. It actually, you probably never really close it, and patients will get upset, and you'll be retreating them either with segmental braces or Invisalign or in-house aligners. So what we do is one of the last steps we do when we do repositioning is we accentuate our molar tube position, and we throw a lot of mesial root tip, particularly on those lower 6s when we extract. And we need those molars to be in a good vertical position because I believe that contributes to space reopening, and very quickly.
All right, thanks. And again, for those of you, I haven't actually said this in a while, I just realized, so anyone who has a question, you can type it into the questions panel over on the right. That's where we're getting all these questions from. Obviously, we're not unmuting people or anything like that. So any questions you have for Dr. Kravitz, you can type them into the questions panel over in your little control bar, and we will get to them as they come in. So I wanted to ask you about staff management. In today's environment is like more competitive than ever, really, in terms of getting and retaining good staff. So would you have any tips to share for how to do that, how to get good people and then keep them, prevent them from jumping ship somewhere else?
So yeah, absolutely. That's an awesome question. And Michelle, thank you so much for that great comment about my honesty. I appreciate it. I hope I'm doing okay. I know we're talking about sensitive topics, and I never mean to do. I got to be me. I hope that's okay. I am very. I always like to kind of keep my heart out there in the open. So I hope that shows integrity. So I hope I'm not saying things that are unwanted, but I know these are sensitive topics, but I think the best way to talk about them is just to talk about them honestly. So in terms of staff, here's what I will tell you. I'm very lucky to have my staff. I overpay my staff, and I'm still underpaying them. I can't pay them enough. I don't wait and give them like 50-cent raises. I give them like significant raises all the time. It seems like every few months I'm giving them raises. They're amazing, and there's no way you should be paying someone who works in an orthodontic office $18 an hour. They deserve twice that. These people work so hard. They are working. I know how hard I'm working. They're working so hard. You can't pay them enough to keep the. You want to keep these people in your life. So a couple things. I do not hire young people. I do not want. I do not want young hotsy-totsies in my office. Sorry to say that, but I don't want like that. It's not fair to my family. It's just not what I want. I want mature people. I really want moms, to be honest with you. I think if I'm a parent, I like the idea that someone treating my child has kids. And I think hiring a lot of 20-year-olds is not the approach. I think those people will last 2 years and then move on to their next job where they work 2 years and then move on to their next job where they work 2 years. So I want people. I love if they have children. I love it if they're the breadwinner, but I hire nice people. You have to be nice, and you have to come to work. And we don't really miss work at our office. We're kind of known for that. So if it's snowing, we're working. If whatever the reason, we're working. But if you hire moms, you have to have this one rule. And we only have one rule in our office, and that is family first. So what I mean by that is, if anything happens with your family, go. You don't have to explain it to me. Just go. It's like, so kids get sick, you got to, that's fine. Like it is what it is. You have to run to school because of a problem, go. And that's the rule. So if you're going to hire moms, you got to have mom-friendly rules. And I get that as a parent. I may not have got that when I was a younger doctor. And now I'm very understanding of it, because sometimes I have to go and go to the school, and I have to go pick the kids up and do stuff. So we hire nice people. You don't necessarily have to have a ton of ortho experience, though I want you to have some dental experience. I will train you. I do all the training myself. You have to be kind. You have to be consistent. You have to be drama-free. You cannot smoke. You can't have visible tattoos. We're looking for nice, happy people. So we talk about different personality types. Everybody wants to hire that I personality, that bubbly, that chatty Cathy. We don't want that. We want that S personality. We want steady people. If you ever go to an office where the orthodontist has been practicing for 30 years, he'll use the term, I have moms or grandmoms working for me. That's what you want. Those are the people that will work for you for 20 years plus. But we do things to make it easy for them to work. So I frequently, I almost pay for lunch seemingly every day. I buy them lunch. I really do. I give them significant vacation days, 3 weeks more vacation. I don't really even look at their vacation days. I need them to be fresh. We are very focused on making sure they are happy at work. And ultimately, you are going to set the tone. So if you are patient focused, if you care, if you are genuine, if you are kind, if you express to them how important they are in your life, you will get that back. And if you don't care, and if you walk on them, and if you make inappropriate jokes and do all the things you're not supposed to do as a boss, that's what you get, because that's the culture in the house, right? The kids model themselves after the parent. That's probably not a great analogy, but I think I'm just trying to kind of explain that behavior-wise. So what I would tell you is I really love my staff. I think they know that. And if there's days where I'm working on a paper or editing a paper and I'm stressed, and they know it. But I think it's not just money. You just can't. So yes, pay people, overpay them. If they want $25 an hour, give them $28 an hour, give them $30 an hour, give them all the 401s, do anything, make them have an easier life, because a lot of these staff members, those checks are so important, and little differences go a long way, but you cannot pay them enough if you make work unenjoyable. So on top of it, we do things to make it easier. And the best thing I can give you to answer your question specifically is family first, right? So if it's a family issue, come on, just go. Don't even, they'll text me and my response will always be family first, which means you don't even need to tell me, we're good. And then I have to work, right? I gotta work. I gotta see the patients, and I'm not worried about that. That's part of it. But if you want moms to treat your patients, and I do, then you have to make it easy for moms to work in your practice. So
good. All right. Thank you. Next question. Which wire and resin do you prefer when bonding fixed retainers?
So this was my angle research I did 11 years ago, or almost 12 years ago. So I tried for my research different types of composite material. My thought was that we couldn't possibly be using the best composite material. We were just using what we had available, but we are actually using the best composite material. So Transbond LR works great. As a backup, I actually like Tetric EvaFlow, the flowable. It doesn't have any flotation. Very odd for a flowable retainer to create peaks. So it doesn't really have any flotation the way LR kind of has that nice drip over the wire. But I almost exclusively use LR, and if I'm in a pinch, I'll use Tetric EvaFlow, which is wonderful, by the way. For the wire, I use lower Ortho FlexTech. I'm a huge Paul Gange and Reliance fan. Paul Gange is one of the great people in our profession, and I really like supporting Reliance. So OrthoFlex Tech on the bottom, I use a stainless steel wire. And then on the top, I used to use OrthoFlex Tech, but I do not like it anymore because it stretches, and even if the retainer stays, you can get a return of spacing in thick tissue phenotypes. So I like to use Bond-to-Braid. Now Bond-to-Braid's great, but Bond-to-Braid breaks and it frays. So also consider using Retanium. So in summary, I use LR for my composite. For the upper 2-to-2 retainer, I'll use Bond-to-Braid or Retanium if they're a grinder, and I use Flex Tech on the bottom for my lower 3-to-3 retainer. I then go over top of it with Essex and Hawley retainers. Good question.
All right, so actually jumping back here, this is a follow-up for the staff we were just discussing. So the question is, sometimes being too generous can lead to staff cutting corners and becoming ungrateful over time. How do you instill that passion in the staff? So I guess another way of asking that would be, how do you prevent yourself from being taken advantage of?
Sure. I mean, I think I do get taken advantage of, but I also think they work really hard. So a couple things. I don't do a bonus system because I think the bonus system, so I've talked about this forever. So orthodontists like to incentivize things. So like if we do so many case starts, we'll pay you more money. But the problem with that is, let's say I'm making this number up. You want to do 50 case starts this month and you do 49 case starts. Well, people will get very deflated. Or what if somebody agrees to start, but they start next week? And the staff says, well, wait a minute. They agreed to start. Let's count that. And what happens is bonuses, I believe, lead to resentment. So what I just do is I don't bonus. I just pay them more. If someone's worth the money, and they all are, I'm just going to pay them. And that way, I just create an expectation of what I want, which is good behavior. But I don't want collection and money goals to be stipulated on. I don't want that their pay to be based on that, because I don't want anybody to be worrying about money. I did that when I worked at the corporation, so I don't want to do that. I have internal goals. I have pressures for my own expenses in my life, but nobody needs to know that stuff, and that can never affect a practice decision, because then I'm no better than a business. So to answer your question is, do I get taken advantage of sometimes? Yes. And they're good enough where I let that slide. And I will say some things, like sometimes I'll pull one over and say, listen, you got to show empathy, guys, right? So you just got to say, what's going on? Are things okay at home? With the last few weeks, you've just not been yourself. Like you're just kind of going through the motions. And they'll tell you, hey, listen, I am taking care of the kids by myself. I crashed my car, and the expenses are over the top. You maybe write a check to help pay for that car. Maybe you do things to help out, but I think what you're looking for is the right team. And when you have the right team, you do whatever it takes to keep them. And ultimately, when you have the right people in your life, whether it's employees or family, you do whatever it takes to keep them. And there really isn't a cost that makes sense where it's too much, because you go, I just want you in my life. If this is what it takes to keep you here, then I want you here. So I'm not too worried about that. And if they take advantage of me, I'm sure there's been days where they have worked well beyond what their salary is worth, even though I'm paying them a lot. So it all evens out. And I want nice people, nice, low drama people in my office. I want parents to come to my office and say, they have nice staff. They have kind staff. They have empathetic staff. It's not just bubbly that I'm looking for. I'm looking for something deeper, something softer, where you really can sense the care, because people are nervous. The mouth, the face is, I can say you can push somebody in the shoulder, they won't even turn around. But if you put your finger on their cheek, they'll get very upset. The face is very personal, and you have to understand that people are very anxious, even adults. And you have to have people who understand that anxiety.
And just right before we get to the next question, just as a quick aside plug, basically, one of the things that Dr. Gorska will be working on shortly, and I don't want to give a date on when we'll be publishing it, but it is a whole thing on hiring. and how to avoid pitfalls in hiring and how to hire good people, because that's where it all begins. All right, so the next question, you do great lingual orthodontics, the questioner says. What is a good resource you can recommend to step into this modality? Can you put forth more tips in this area?
For lingual orthodontics?
Lingual, yes.
Yeah, so I did a lot of incognito a few years ago. I pulled away from it as my Invisalign really took off, and I got better at Invisalign. So I really don't do a lot of lingual braces too much anymore. Occasionally I will put labial brackets on the lingual if I have a non-compliant patient who refuses labial brackets. Believe it or not, that actually works fairly well. I'm very interested in InBrace. It's a wonderful company. We're going to try to get some InBrace articles in the JCO. John Pham is just one of the great engineers and people in our profession. Just really like a company that comes at it from a scientific and an engineering position. Dr. Weekman is going to be introducing his WIN bracket, which is kind of the evolution of what the incognito bracket was. So we might be seeing that in the future. I'm very excited. In terms of reading, there's a lot of articles in the JCO on lingual brackets. There's so many doctors in Europe and in Asia who are practicing lingual orthodontics all the time. So if you're not subscribing, I encourage you to, and you will see a ton of case reports on lingual orthodontics. But I think in the U.S., the future of lingual orthodontics will probably be coming from InBrace.
All right. I'm going to try to get these last ones in if we can. So next question is it possible to get tooth movements on patients who have been on biophosphonates for 10 years and stopped 2 years prior? I've read the half-life of biophosphonates is greater than 10 years. It's
hard, right? So, we're so worried about osteonecrosis, and Dr. Rinchus wrote a wonderful article on this in the AJODO, if I could remember, probably came out in 2006 or 2007. I encourage you guys to read. I believe even John Graham has probably written some articles on bisphosphonates. It's hard, right? I've never had a patient, of course, have osteonecrosis. And I think I'm not sure if we are worrying too much about the complications. But I will say that when in doubt, be cautious. And I think that is a good rule of thumb. Certainly, depending on how the medicine is taken, will depend if there is a higher risk. Obviously, and how long they were taking the medicine will also affect the risk. But I think, again, going into orthodontics, this stuff is elective. And if the risk outweighs the aesthetic benefit, we're just not going to be doing it. I just don't think that is the emphasis here. I'd rather the patient pursue cosmetic dentistry.
And I think this will be the last question as we're just hitting the top of the hour here. It's becoming harder and harder to find senior mentors, doctors to work with. How do you recommend finding someone to help mentor new grads? Or do you know of any in-office learning options?
Sure. Well, friend me on Facebook. People do all the time. I really mean it. I hope my energy comes through with the JCO, and I hope you see in the coming months my personality come through a little bit, and I hope that's okay. I hope that's I gotta be me, as I said. But if anybody needs me, I always try to share my story because it's not a perfect story, and I love to help people out. And if I can provide any assistance, I will. And you can always message me, friend me on Facebook right now, and I'll try to respond immediately. I'll pick up the phone on the way home from work. And I think a lot of people will. Our profession loves to help people. We are inherent. Teaching is part of our core. It's why we went into this field. And there will be people that will want to teach you. I think senior doctors want to teach younger doctors about all the errors they've made, all the mistakes they've made. And if you are around people who aren't that way, get away from those people, because that's not the type of environment you need to be in. We don't need to be competitive. We don't need to be annihilating people. you're not having any impact on their business anyways. And actually you want to be around people who talk and who share and who open up. And it's cathartic for the older doctor, and it will be so helpful for the younger doctor. I wish I was mature enough to ask for help, and that was part of my problem. But there are people out there, and in our area we have a local study group. I encourage you to do that. You just need one. You just need one doctor, and they're out there. And I know there are people like me who want to help and want to help younger doctors avoid the mistakes that they have made.
All right, well, I think that's a good place to end on. If you did not get your question in, or if you have a question that occurs to you later, Neal, can people contact you with any questions? How would they go about doing that?
Yeah, just send me a message, and I can even put it on the JCO Facebook page, and post it there, and I'll post the question and the answer. And I can do that. Fire away, ask me anytime. This webinar was just a jumping off point, but guys, keep these questions coming as forever. I really love helping out, and please join. Please encourage people to join. I really mean this. The JCO is a family-owned journal, and it's been that way for 55 years, and we need to support it. And your subscription, if you are happy with what I am doing in the profession, and you are happy with some of the teaching that I do, the greatest gift for me would be to encourage a friend or a colleague to subscribe to the JCO.
And so contact you, Facebook, email, what's the best way to contact you?
Great,
so,
all of them, yeah.
Okay, your email address, for those who don't have it, is?
Just Neal Kravitz, one word, @gmail.com. Neal Kravitz @gmail.
Great, so thank you. And this will also, we recorded this, so this will be up on our website and everything. So I want to thank everyone for attending. Hopefully got something out of it. And also, I should not forget to plug your webinar, Neal, which is coming up in a month, basically. There'll be a regular webinar on retention. So you can sign up for that at our website. And that is subscriber only unless you want to pay for it. So better off just subscribing. So thank everyone. Have a good night.
Thanks, guys.
And we'll see you soon.
Thank you so much.